When you start your enrollment into Medicare, you got a big decision to make. Are you going to go Medicare Advantage Plan, or are you going to go Original Medicare with a supplement plan? Most people don't even realize that they have to make this decision, and when they find out, they don't even know the difference between an Advantage Plan or a supplement plan. So today, I'm going to talk to you about the basic differences between Medicare Advantage and Original Medicare with a supplement plan or a medigap plan. So stay tuned.
Hi, I'm Jamie Banner. I'm a licensed insurance agent that works specifically with people enrolling into Medicare. And today, I'm going to talk to you about the basic differences between Medicare Advantage plans and Original Medicare with the Medicare Supplement Plan. Now, before we get into it, if you find this information helpful, please give this video a thumbs up and subscribe and leave a comment down below. It helps let YouTube know that this is important information that people really need to see. Okay, let's dive right in. You turn 65 and you got your red, white, and blue Medicare card. You've got your Medicare number, your effective dates, but you're not quite done. After you've done your Medicare enrollment, you've got a big decision to make. Are you going to go Original Medicare or are you going to go a Medicare Advantage plan? That's right. So when you come into Medicare, you can either go left or you can go right, but you can't do both. So it's really important to understand the basic differences between the routes you can take. So let's get right into it. We're going to talk about these differences. One really big important one that everyone's concerned with is the cost. So first thing is the monthly premium. With Original Medicare, your premium can vary from about $50 a month to $200 a month. And this can all change based on what type of plan you choose, your location, your age of enrollment, and even your gender. So it can really vary based on those factors. With your Medicare Advantage plan, kind of the same thing. I'm sure you've seen all those commercials of $0, all inclusive. And that's true. You can find a Medicare Advantage plan for a $0 premium, but they can also range up to as high as $100. And you're going to want to look at, if you've got such a low premium, if there's any other costs associated with it, which is the next thing I want to talk about, and that's your out-of-pocket costs. So with your Original Medicare and your supplement plan, you may have a higher premium, but generally your out-of-pocket costs are going to be a little bit lower. You have to pay your Part B deductible for most plans, but other than that, with a lot of plans, that's it. Other than your monthly premium, you've got no other out-of-pocket costs, so everything is pretty stable. You know each year generally what you're going to pay. With Medicare Advantage, it works a little bit differently. You might have that lower premium, but then you've got some variable out-of-pocket costs that are kind of like a pay-as-you-go. You know, you've got a deductible generally with your Advantage plan. You've got an out-of-pocket maximum. You've got some other things to think about that when you use your plan, you might incur charges as you go. What about prescription drug coverage? With Original Medicare and a supplement plan, prescription plans stand alone. So you would enroll in your supplement plan and then you would also enroll in a prescription drug plan. And there's a ton of different options based on what pharmacy, what medications you take, and they can be generally inexpensive depending on what medications you're on. With your Advantage plan, most of the time your drug coverage is included. However, you can still have some out-of-pocket costs with that, and again, it really depends on A, your plan, and B, your prescription. So you want to make sure your plan is going to include the prescription drug coverage you need if you choose to go an Advantage plan. Big factor here, big difference between the two is your choice in doctors. So with Original Medicare and a supplement, there are no networks. If the doctor takes Medicare, you can see them, and that's from Florida to California. You can go to any doctor across the country. If you're living half here, half there, you don't have to worry about making sure you stay within your network. There's no out-of-network charges. Again, they take Medicare, they take your supplement plan. Advantage plans, not so much. You are limited to your network, so you have to see doctors within your network. You can go out of network a lot of times, but there's going to be additional charges for out of network. So you're going to be paying more money to see a doctor that may not be within your network. And even on top of that, if you see specialists, you're going to need referrals. So you would need to go to your primary to get a referral to any kind of specialist you want with an Advantage plan. So that can kind of slow things down in the process and limit you. And also, again, specialists, needs to be within network. So that can get a little tricky because doctors also don't have to stay in your Advantage Plan network. They can come and go. So you want to make sure, if you're on Advantage Plan, that your doctors you're seeing are within your network. But again, with Original Medicare, not something to worry about. There are no networks. If your doctor moves all the way across the country, you can follow them if you want, and you can go see them in their new state. As long as they take Medicare, you're good with your supplement plan. And the last thing is Part A and B. So with Original Medicare, you stay with Part A and B. That's why it's called Original Medicare. So it keeps that Original Medicare structure. You've got your A, you've got your B that covers your 80%, and that supplement just does supplemental coverage. It covers that 20%. So it supplements A and B. It's kind of semantics. With an Advantage Plan, you stray kind of away from Original Medicare and you're getting into a more privatized insurance. Your Advantage Plan pretty much takes over what Part A and B were, and now you're kind of under this private insurance carrier. So it's not really a Medicare plan now. It's more of a privatized insurance plan. So again, you've kind of strayed away from Original Medicare and you're more into like an HMO private insurance environment. So again, pretty different plans. Original Medicare could possibly be a little more costly with premiums, but you're paying for your freedom. You're getting a lot more freedom in your choice of doctor, your choice of hospital, your own health coverage. Medicare Advantage Plan, less expensive, definitely makes sense if you're on a fixed income, but you are more limited. And I always say, the prettier the package is, the more you need to dig in and see why it's so pretty. What am I giving up for this low premium cost? So, I hope that kind of helped explain just the basic differences between Original Medicare and Medicare Supplement Plans. If you've kind of decided and you know where you're going to go, I assist with Medicare Supplement Plans. That's what I do. I can help you find the Medicare supplement that's going to make the most sense for you. So, if you have any questions, feel free to call me. My number is 833-65-JAMIE. You can visit my website, medicarebyjamie.com, or you can even email me at jamie@medicarebyjamie.com. Again, if you like this video, please give it a thumbs up and subscribe. Leave a comment down below. I also, again, like I always do, put a movie quote in there. So if you can tell me what movie that's from, comment it down below. And thank you so much for watching.